great to see both familiar and unfamiliar faces here. My name is Kerri. I'm an e-patient. I have asthma and ADHD. I'm an advocate, a blogger, and writer, and a bit of a troublemaker. As such, you know my little hospital bracelet here? I had to go visit the ER at Stanford yesterday. Everything was fine, so that's good.
And I'm Sara. I'm a caregiver. I'm also I have two boys who have type 1 diabetes, and one of them has Crohn's. Them as well. I think I'm photographer.
This is our intro slide.
So when I think about the traditional, there's huddled around a circle, and that's not going with online and our connecting with patients and Facebook groups and everything.
So, in the context of this discussion, we really have to define what social support actually is in order to figure out how we're going to provide that as a service to patients. So, social support in the Merriam-Webster dictionary form is the perception and actuality that a person is cared for, that they have assistance available for other people, and that they're part of a supportive social network. So, in this discussion, we're going to focus mostly on emotional, non-tangible, psychological support in sharing experiences of chronic disease. Or, in the case of yesterday, my friend Dia, who was being in the peanut gallery back there talking to us, she was the one who was hanging out with me in the Stanford yesterday. And having these kind of supports available, which are not not doing things like buying groceries, but just chatting people through what they're going through, has been demonstrated in research from the University of Minnesota to be a literal lifesaver. And extensive social support leads to better outcomes in terms of various health conditions, most notably actually leukemia. And people with heart disease have better outcomes and better survival rates if they have a strong social network. Social support can also, in absence of chronic disease, encourage health-promoting behavior. So people who have a good community around them are more likely to not use alcohol or tobacco or abuse substances. And they're also more likely to adhere to chronic disease treatment or even just a course of antibiotics. And they also have decreased mental health risks and improved immune system function. So it's always good to have friends, right?
And social support can be found in components in many different ways, such as support groups and education initiatives.
So the type we're kind of focusing on more here at Medicine Act is the online type of social support. So this can come in a lot of different forms in terms of social media. So you think of Twitter, where we're all busy on hashtag MedX today, but there's other Twitter hashtags and chats that connect patients and caregivers, or just healthcare experiences in general. There are Facebook groups that are focused on a variety of different health conditions. Instagram is really rising up in terms of being a social network that helps people find others like them through visual imaging, which is very cool. And blogs are also a form of social media that I use for day is social media. So there's also kind of specific support communities available online. So it's not just everything's not just centered around a hashtag. There are websites that are just kind of built-in ecosystems of finding support. So the examples I have on screen here are 2 Diabetes, which is a Diabetes Hands Foundation site based here in California, where people with all types of diabetes can discuss issues that they're having and help each other troubleshoot. As well, Smart Girls with ADHD is a community that I'm a part of. It's a blog, a website, and a Facebook group where women with ADHD can connect with one another. And for the most part, a lot of us are diagnosed when we're older or like as adults, and there's a lot of emotional struggles and troubleshooting and kind of life hacks that we get from each other on this sort of group. So next we have kind of what I like to call the hybrid model of bringing the traditional support group online. So There's using conference call software, there's ways to connect patients to one another that have similar needs, or to provide some educational support. And some notable examples that I'm aware of in Canada is the Allergy Pals program with Food Allergy Canada connects children who have food allergies to one another. These programs are facilitated by peer mentors who are usually young adults who have these sort of, who have food allergies. As well, the Asthma Society of Canada is starting on Monday. We're starting a Asthma Pals program. So I'm going to be a peer mentor with this program, and over the course of 8 weeks, we're going to go over 8 one-hour sessions with the 5 children that we have in our group on different topics related to asthma. So the kids can connect with one another. We're going to play some games on the conference call software. I don't really know how that works. And go through different different topics relating to kids self-advocating, school, sports, stuff like that. And the interesting thing about these programs is they're actually based out of the University of Alberta did a social support research study that focused on kids with allergies, and mostly environmental allergies, in low-income families. And they provided internet access, computers if needed, to these families so that the kids and the parents could take part in these kind of programs. And then they did all kinds of sciencey stuff and measured the actual impact of that program. And it was, the impact was pretty profound. So many patients will also reach out online and in person.
And one important thing to remember with having social support is that not everybody's going to want to participate. So it's reasonable within 6 months to a year or a year and a half. Double check with your patient. That's something that they may want to do.
The other thing as well is that social support can serve everyone who chooses to engage. Everyone who has unmet needs can be well served by having social support. In this, it's important to understand what kind of communication needs that you're seeing in clinic have. So do you have patients who have shift work and maybe they can't make it, or even call your practice during office hours? Do you have patients that have communication disorders like autism or social anxiety that may have trouble speaking with people in person but who can communicate effectively in writing? If you're part of hearing or deaf patients, it's of course common sense that you're thinking, I'm going to need to be able to offer that person teletype access, but maybe they prefer email. So there's a lot of opportunities to engage with people who might not have ways to communicate in traditional verbal means. As well, rural patients can also be well served by having online social support because their chances of connecting with someone locally are even lower than those of us who are in urban areas.
Who are looking for social support, they're looking online, so it's actually like when my son was diagnosed with Crohn's, he actually told us that he can't help us, but we should go online and find the Facebook community. There's already on that, but at least he gave us that option of going online too. And the potential negative outcomes that will support prescribing, one, doctors already have these. Problems can be mitigated with proper education support. Every risk is both have had both negative experiences. Positives far outweigh the negative experience. Positives, which are fantastic, they allow for improved problem-solving abilities, greater engagement, greater self-reliance, better emotional and social adjustment. Strong social network decreases
a doctor. I'm not telling you how to do your job. But there are reasons, obviously, to discuss social support with your patients. Obviously, we saw the data at the beginning. There is data that it's going to lead to better health outcomes, and that's what we all want. So why should you discuss it with patients? Because one, they might not know what's out there, or you as a healthcare team member may also learn something that you don't know that you can provide to other patients. So of course, coming into this, there's a lot of ethical gray areas in terms of prescribing social support, especially online. So some ways you can kind of deal with that are leveraging local or national nonprofits. I think most healthcare providers wouldn't hesitate to send a patient to something like the Crohn's and Colitis Foundation of America, Food Allergy Research and Education Network, Juvenile Diabetes Research Foundation, and you probably have brochures in your practice from these organizations. So these are a good way to start connecting people with social support. You can provide materials to patients. The Diabetes Hands Foundation that I mentioned earlier with 2diabetes.org, they have actually a postcard handout for endocrinology offices that say where to find the diabetes online community. And there's hashtags, links, and the benefit to having a handout is that it can either be passive or it can be active. So if you, for example, aren't necessarily ready to have that discussion with patients, you can have a postcard sitting on the corner of the desk or a check-in, and patients can take a look at it, and if they're interested, engage. If you see them looking at the postcard, you can kind of start having a discussion about that. And the key here is that providers have to really emphasize not making changes to your care plan without their advice. And I think that's the problem that we're all thinking is like, oh, that's an issue. So the key here is to listen to and value the patient or family experience and their attempts. So professionals can obviously learn something from patients, and you guys know that because you're here. And if you go online, explore resources for yourself, have a list of resources that you have found trustworthy and worthwhile. And if you have engaged patients coming into your practice, you probably can tell because they're probably asking you 800 questions that are not very normal. And these people can also be really good sources of helping you find good information to then pass on to other patients. As well, there's also leverage your colleagues, right? If you have colleagues that are really up and coming and know what's going on in this, ask them what they're recommending to patients and how they do that in your specialty. That's it for us. Thank you very much. Questions? Yeah.
That's where I'm MacKay. Can you either talk about, I mean, we talked about his online social support, advice for patients that feel that maybe not finding the right niche, or they're not finding, or they're finding a lot of people who can live in diet, not comfortable with different phenotypes, what they should do.
Yeah, only you would ask me a question of all the phenotypes. It's a tough question because I think the reality is that people really seek support at the beginning when they're diagnosed, and then a lot of them drop off after they kind of get the hang of things, right? And Sara, you might be able to speak to this better because the diabetes community is really good in that way, that they're providing constant support to one another. So I don't know if you...
So when my son was diagnosed 5.5 years ago with type 1 diabetes, I was a single mom, so I thought the world was over because I had my kid with a needle every day, and he played semi-professional. Well, I was, first 6 months, I was in a big funk, and I was like, this is it. I'm like, I have to be able to be healthy to be able to care for my son. So I was like, well, I'm getting what I need from my doctor, so I'm going to try. I went, and I was already out previously on Twitter, but I was just random.
That's my life, Sara.
It was prior to diabetes. It was just like, oh, I had this for breakfast. But when I found the diabetes social media advocacy, I found out that there was weekly Twitter chats about diabetes for everybody in their everyone was welcome. And that's actually how Kerri and I met. She does not have diabetes, but she was there and she was floating around. Yeah, so we started talking and we became friends. But to be able to find the information that you're looking for, it's what you're looking for, and there's not everybody. Not as specific.
Yeah.
You do have some cases where notification, and you could take
That's an excellent question. I think, I think really it's about having that conversation with people. So, I've never been asked about, do you talk to people who live with the things you're living with regularly? So, just asking patients, do they feel like they have support? Do they feel like they need to connect with other people who are like them and having other certain experiences? As well, and I think Sara mentioned this, is that it's also beneficial for parents of kids with chronic diseases to connect with adults who are living with that same condition. So I think it's, and there's all kinds of, privacy issues with that, but, finding people to connect people with, right? And in terms of medical education, I'm also not sure how to make that recommendation. Especially as we're from Canada, so the system does look slightly different. Yeah, we're being a little patriotic over there. Sara, do you have anything to add to that?
Not really. Like it is all specific to healthcare provider and what they're comfortable prescribing or asking their. Myself, I would say definitely the online, like social media. Having even like a weekly online.
And I think as well though too with the younger generation of doctors coming up, it's going to become easier to facilitate that because those people are going to be immersed in in that kind of ecosystem already. Good question.
No, I think I just want to education component. I think I was having a conversation with her. But I think there's also a component of bringing kind of that knowledge of what, what do you actually need or do you actually. Yeah, almost everybody's online or connected somehow. But I'm like, by the time I found a hashtag, that, like in anything with the time constraint, 5 or no one knows patients' community.
Yeah.
Like I recently found about it's like trying to research and like, well, she asked like, how did you find that information out? Because it was not like other than my. Oh, I found it on something I posted, and then like. Lots of things, especially for by taking solutions. I think even knowing that that's negative information that might be.
Yeah, thank you for that, but you're running our presentation over
Sorry.
time. Yeah, exactly. Now we're going to end it off.
Great. Thank you so much.